Hey everyone, Dr. Charlie Johnson, physical therapist, back pain specialist here, and today I want to talk about the know in spinal stenosis, meaning what we know is that there is no correlation or little correlation between spinal stenosis imaging findings and pain, and yet people are walking around being told that they have these problems based off some image, an MRI or an X-ray or something like that. And yeah, they're being told they have it, and it's the cause of their back pain, leg pain, numbness, or tingling, all right? So I want to talk a little bit about spinal stenosis and ways that you can actually prove or disprove to yourself without actually going to see a physician, or you can prove them wrong, that you have or you don't have spinal stenosis. So I want to help you figure out whether or not spinal stenosis is the actual true cause of your problem. So a little bit of background, all right, is that we have evidence or papers, research published, right, in the medical world that unfortunately, if you're watching this video, you probably don't have access to, that lay out specific criterion for the diagnosis of spinal stenosis, all right? So what we know is that some of the common things are age, all right? So age greater than 48 is one of the findings. So generally, these people are a little bit older or wiser, if you will, all right? So that's one, all right? These people often have both-sided pains, meaning they have pain, numbness, or tingling that's going down both legs, not just one leg. It doesn't mean that if you have spinal stenosis, you can't just have one-legged symptoms or one-sided symptoms. It's just very common with true spinal stenosis, both-sided. The third thing would be leg pain, worse than back pain. So often we see in true spinal stenosis that the leg symptoms are very bad, meaning people are walking and they're getting burning down their legs, maybe numbness in their feet, pain in their calves, their hamstrings, and so I just said when they're walking or standing, so pain walking or standing, and no pain sitting, meaning the pain completely goes away when they sit. So if you've been told you have spinal stenosis and you get your pain in your leg or wherever it is when you're sitting, that automatically pretty much disqualifies you from having true spinal stenosis. We'll talk about at the end of the day, it doesn't really matter what you have. We just need to figure out how to get it to go away, all right? And really, if you're watching my past videos, you have to understand what makes your pain, regardless of the label, right? What makes your pain, numbness, or tingling better or worse, right? Often in people with spinal stenosis, right, they have both-sided pain. They have pain, numbness, or tingling in the leg that's worse than the back. You may have no back pain at all right? You don't like to walk or stand, and sitting relieves it. So in this criterion, if you have 4 out of 5 of these, could be any 4 of the 5 of these, all right? This is a must. You must have this one, all right? So we'll check this off, let's just say. Maybe for whatever reason you don't have leg pain that's worse than your back pain or whatever, but you have 4 out of 5 of these criterion. This is a definitive, all right? Your pain should completely go away when you sit, and it should be there when you're walking or standing, all right? Then you have a 76% chance that you have spinal stenosis. Pretty good, okay, and helpful if you're watching this video and you're wondering that. Some of the other things you often see is that, and this isn't per se like something that we have written in the research, just based off my experience and the people I've worked with, spinal stenosis is often very consistent. Meaning, I had a lady today that she says, you know, I walk past 6 houses, and every time I walk past the 6th house, that's when I get my leg pain, right? So the point is that it's to a T, pretty reproducible. You have something that clearly makes it worse, and you could time it. You could put a number on it, right? Or a number of houses on it in this case, right? So you should be able to, a true spinal stenosis, start walking, hit the clock right before you start, say go, start your timer on your phone or whatever, look at your watch, and at a certain point, you know, within 15, 20 seconds difference of each other, you should notice that you start to get your pain if you consistently test that, right? So consistency of symptoms is key. You know, generally spinal stenosis because it's a true narrowing of either the canal or one of the holes where the nerves exit. It's not going to be something where you can walk all day and feel great, and the next day you can barely walk, and when you sit down you have pain sometimes, but other times you don't have pain. It should be pretty consistent, all right? So that's the other thing about spinal stenosis. Let's see, what else? So it's consistent, it's reproducible, you've got all these different variables. And reproducible, right? Let's go back to talking about variables and what makes spinal stenosis unique, right? So often, I just had a lady who said this to me. She said, you know, when I'm walking, I have to lean, call us a positive shopping cart sign. I have to lean on a shopping cart to take my back pain away. She didn't have leg pain in this case, but if you do, maybe you have to lean forward to take your back problem away, all right? And then, right, so here she is. She's walking along, and then when she leans forward on the shopping cart, if this is pain, this is 10 out of 10, and this is 0 pain. She's walking along, her symptoms are building, and then she leans forward on a shopping cart, her pain goes away. She can walk lean forward, and then as soon as she stands up, the clock starts again. Okay, Charlie, I want to bend forward. As soon as I lean forward, it goes away, and then it reproduces itself. You can turn it on like a light switch, all right? Now, a lot of people use that, and I've seen surgeons, other PTs, and other physicians ask the question of like, okay, so what happens when you lean forward a shopping cart? Oh, it feels better. Okay, you've got spinal stenosis. No. So I want to teach you, or maybe not no, but possibly. That's not a great question, and I'll tell you why. So this is the big picture of spinal stenosis. You can either have one-sided or both-sided symptoms, and I think I explained that in one of my previous videos, all right? But let's answer this question of, if I have spinal stenosis, Charlie, I have all those things. I've been told I have spinal stenosis. Here's one way that you could prove it wrong, or prove it right, all right? Or at least start to get closer to the truth. Right, so what we know is that when you're up and walking, there's your hand or whatever, right? And you're going this way and you're just kind of cruising along. You got another arm. If we zoom in on the spine looks like this. And so on and so forth, right? And there will be like the side of your hip. But your back is kind of in a little arch, right? Has a little hollow to it. Right? And what we know is that spinal stenosis is basically a narrowing of the spaces where the nerves travel. So what we know is that when we stand in an upright position, we reduce the space where the nerves live by about 30% naturally. Throw in some arthritis and things like that, and we have even less room for the nerves to operate, right? So with that being said, the reason people often have pain with this, notice this person, they're walking or standing, they're upright, is because of that. So when they walk or they stand, the joints in the spines have more contact with each other. Think of your spine like a slinky. It's closed down on the side. And the nerves that try to come out the back and go down the back of the leg, or in the center of the spine, don't have as much room to function or to breathe. So therefore, as you go and oxygen gets cut off to the nerves, you start to get these leg symptoms, right? Then, as I said, one of the most specific things to help diagnose spinal stenosis is this idea of sitting or bending forward the shopping cart relieves, right? So when you sit, here you are, you have pain, you're just looking for that next bench, right, to sit down. Here you are, you're just chilling there, maybe on your phone or something, right? You're sitting, right? Or when you're on a shopping cart, this is your shopping cart, whatever, right? You know, you're kind of lean forward on it. So you've got the concept, right? Here's your eyeballs and here's your foot. The idea here, right, and the reason that it relieves symptoms of people with spinal stenosis is because if you think like a kind of a mechanic, right, your spine looks more like this. Right, if we zoom in on that and we pull it out, right, spine gaps meaning the spaces where the nerves travel and the joints are no longer really in contact. Therefore, your nerves have more room to breathe and function, and you feel pretty well. So you don't have back pain, you don't have leg pain. All right? Now, people take that too far when they just say, oh, you have pain when you stand and you walk, okay? And, oh, you have pain, all your pain goes away when you sit, or when you lean forward, you've got spinal stenosis. I want to teach you to answer that question and to be your own advocate, all right? I want you to come up to with your own conclusion, all right? And the way you're going to do that is you're going to say, well, what if people are wrong? Meaning, test this hypothesis. So right now, it seems as though when you're standing, all right, things are worse. It seems as though when you bend forward, things are better. But what you have to understand is when you're just slouching and relaxing on the back of a chair or into a soft couch or whatever, or sitting on a bench, right? Or you're bent forward and you're supporting yourself on the countertop, or you're supporting yourself on a cart, there are two things that are happening. Most people think of it just like this. Yes, your joints are moving and it's creating more space for nerves and structures to feel better, right? The other thing that's happening is it's relaxing your back muscles, all right? So there are back muscles that when you're standing up and you're walking, right, they have to contract to keep you from falling forward. People with spinal stenosis often are pitched forward, right? So they walk into the clinic like this, slightly bent forward. Well, if you've ever done any amount of work pitched forward, washing the dishes, right, your back might get pretty tired doing that. So consider that these people are walking around, maybe you, if you're slightly pitched forward because you think that that's going to do this, but it's not quite working, and you've been told you have spinal stenosis. Consider that the reason that you have pain when you stand or you walk is because your back muscles are turned on all day trying to prevent you from falling forwards. Basically, they're overworked. And when muscles are contracted all day, anytime you go slightly forward, your back muscles are going to have to work. Anytime you go slightly backwards, your abdominal muscles are going to have to work, right? So get that when muscles contract, picture it like a towel, right? My back muscle contract, it kind of wrings things out. The muscle tenses and reduces blood flow to the area. So, what you're going to do is you're going to test this experiment. So, while bending forward or sitting might make you feel better, understand it could be for one of two reasons. It could be because you're decreasing the pressure on nerves / joints, right? In this scenario, so this is scenario 1, right? Or it could be because, this would be 2, right? You are relaxing your muscles. You're shutting them off. So, to prove and realize that spinal stenosis is not by diagnosis, a muscular problem. It's a joint problem. So you can challenge this hypothesis. And what I mean by that is, if you're understanding this, is how do you shut your muscles off when you walk? I'm going to show you. It's very easy. Stop walking like this. So basically, stand completely vertical, maybe even bend backwards a little bit as you walk. And notice what that does. If you had true spinal stenosis and you stood up even taller than you usually would, very upright, almost leaning back a little bit, and your symptoms get better, then you don't have true spinal stenosis. You might have some other stuff, but that's not really what you have, right? Because it should be making it worse. It should be creating less spaces for your nerves to travel by bending backwards, right? If your symptoms feel better with spinal stenosis when you're bending backwards or when you're walking very upright versus when you're in this slightly bent forward position, then you do not have spinal stenosis. Probably what has happened is that now you've just relaxed your back muscles. Now your belly muscles are having to work a little harder, right, to keep you from falling backwards, but you've actually reduced the activation of your back muscles, all right? So the point is if you're walking along, this is maybe the take home, right? And you're thinking that I lean on a shopping cart, that's me because I have back problems and I have spinal stenosis and I like to kind of create some breathing room for my back, and I've been told that when I stand I pinch the nerves off, X, Y, and Z, right? If you're walking, what I challenge you to do is use movement to answer that question and to challenge that theory, right? So if you're walking and you go ahead and bend back more, almost what you're told not to do with spinal stenosis, and your leg pain and or your back pain gets better, then it's not true spinal stenosis. Probably what it was is that you were overtaxing your muscles, right? And then just sitting or relaxing on something shut them off or had them work less, right? And that felt better for you. If, when you're walking, the more you bend back and the further you walk, your symptoms get worse, and it makes it worse than it had before, right? Then it's possible, and it helps support the diagnosis of spinal stenosis. So realize that when you're walking, you're going to come with a hypothesis. If it's true spinal stenosis, then bending backwards should make it worse, right? Or walking very upright versus here where I thought I was helping myself, forcing myself to walk very upright should actually make true spinal stenosis worse. Then you're going to test it, and you're going to say, do I feel sane? Do I feel better? Or do I feel worse? If you feel better in a very upright position as you're walking, then it's not, you're actually increasing the pressure on the nerves. Therefore, it can't be spinal stenosis that's causing your back pain, leg pain, numbness, or tingling, right? Instead, it was probably that you put yourself in a better position such that you were putting less pressure through your back muscles, and your back muscles that were working very hard, lean slightly forward, can now receive the oxygen and the nutrients it needs, and they don't have to work as hard, all right? So, if you feel worse when you walk very upright and you have spinal stenosis, and you kind of exaggerate that motion when you're walking, right, then it still is possible, or it increases the likelihood that you actually have true spinal stenosis, all right? So that's one thing, right? You could easily use that walking test in the clinic. I see people all the time say, I have spinal stenosis, and then they're walking and say, yeah, I love to bend forward on the shopping cart. When I sit, it feels pretty good. But then they start to show some differences in their story. They say, you know what? I still have pain when I'm sitting, though. And I notice it sometimes when I'm driving too long. They don't have spinal stenosis. They might, but it's not the cause of their symptoms, all right? Then when they walk, and I have them walk very upright to prove or disprove what's going on, they say, wow, it actually feels a lot better when I walk vertical. I say, you were just taxing your muscles. Right now, theoretically, if you have true spinal stenosis, you should be jamming down more on your nerves and your joints. But by actually doing that, you actually feel better. So it's not true spinal stenosis, right? So understand that sitting and bending forward is not just specific to creating more room for your nerves. It could be that you're just relaxing your back muscles, and that's why it feels good, all right? So to tease this out, you can do a simple walking test to assess, based on whether you're same, better, or worse, whether or not you have true spinal stenosis. If walking very vertical, excessively vertical makes you worse, and you fit all those criterion of age, no pain with sitting, leg pain worse than back pain, both-sided symptoms, you very well may have spinal stenosis, all right? If, as you're walking, and you walk very upright, you feel better, then spinal stenosis goes way down on my primary cause of your back problem list, all right? And also, just to take home, realize that they've done outcomes to look at people who have had surgery for spinal stenosis, and what they found is that there's no long-term difference in people who have laminectomies or decompression surgeries for spinal stenosis versus those who have conservative treatment. It's not to say everybody will respond to it, but your best bet is to get PT first. So again, this is Dr. Charlie Johnson. You can reach out to me directly, Charlie Johnson, DPT, as in Doctor of Physical Therapy, @gmail.com, and or make some comments, see what you thought about this thought process, okay? Thanks.